If you turned on the news, scrolled through your social media, or checked your phone lately, you've probably seen some pretty alarming headlines about Medicare. Things like Medicare Part D is ending, the Trump administration ending Medicare Part D subsidies, or millions of seniors facing massive cuts. Here's the plain truth right up front. Medicare Part D is not ending. Nothing sells quite like fear. Outlets and influencers know that dramatic headlines drive clicks, but sensationalism doesn't help your budget or your health care. In this video, we're stepping away from the political spin to give you 100% factual, objective information about what CMS actually announced regarding Medicare Part D premiums for 2027, what changes are coming, and most importantly, what you need to do about it. So what are these subsidies and why were they even created? To understand what's changing, we have to look back at how we got here. In 2022, Congress passed the Inflation Reduction Act. This law introduced major out-of-pocket protections for seniors, including capping insulin at $35 a month and creating an annual out-of-pocket spending cap for prescription drugs. So remember, in 2025, we had a maximum cap of $2,000. In 2026, it's $2,100. And set for 2027 is around $2,400. While that capped what you pay, it drastically shifted financial responsibility onto private insurance companies offering these standalone Part D plans. Because insurers were suddenly responsible for paying a much higher percentage of the high cost of drug claims, CMS recognized early on that insurance companies might respond by drastically raising monthly premiums overnight to cover their risk. To prevent seniors from facing immediate massive premium spikes, the Biden administration introduced a temporary helper program in 2024 called the Part D Premium Stabilization Demonstration. The subsidies were always intended to be temporary. Here's a vital piece of context that many headlines intentionally leave out. These subsidies were never designed or legislated to be permanent. When CMS established the demonstration in 2024, it was explicitly created as a multi-year temporary transition period originally planned for up to 3 years to give insurance carriers time to learn how to properly price their plans under the new drug rules. Think of the program like a temporary discount the government gave your insurance company for 2 years to keep your bills lower. So in year one, which was 2025, the government knocked $15 off the starting price of the drug plan each month. On top of that, they made a rule that insurance companies couldn't raise your monthly bill by more than $35. In year two, that changed. That's this current year, 2026. The government lowered the discount amount. Now they were only knocking off $10 on the starting price and allowed insurance companies, though, to raise bills by up to $50. It was a step-by-step way to cushion the price increases before taking the discount away completely. The program did its job. It cushioned the market for 25 and 2026 while insurance companies recalibrated their financial models. So why is CMS ending the program after 2026? Following the preliminary bid reviews for 2027, federal health officials at CMS announced that the demonstration will conclude at the end of this year, returning Part D to traditional market conditions in 2027. Why? CMS evaluated the preliminary 2027 plan bids submitted by insurance carriers and concluded that plan sponsors now have sufficient experience operating under the Inflation Reduction Act redesign. In short, officials determined insurers have had enough data over the last 2 years to price their plans accurately without relying on extra government dollars, which, just so you know, totaled $9.8 billion across 2025 and 2026. It's also worth noting, ending this demonstration program does not take away the main federal government subsidy for Part D. the standard statutory federal direct subsidy that supports these Medicare drug coverage plans remains intact. What is ending is only the extra $10 per member per month temporary stabilization cushion. So what does this mean for your 2027 plan, and what should you do? Well, number one, standalone Part D plans may see premium adjustments. Because carriers will no longer have that extra $10 monthly government cushion, some standalone drug plans may increase premiums, alter drug formularies, which is your list of Medicare-covered prescriptions, or adjust preferred pharmacy networks. Now, if you have a Medicare Advantage plan, that's a little bit different. So Medicare Advantage plans are impacted differently. The stabilization subsidy was specifically for standalone Part D plans. That's the kind paired with typically original Medicare and someone who has a Medicare supplement / Medigap plan. Medicare Advantage plans with prescription drug coverage, though, use different cost offset mechanisms such as rebates, so they are structured under completely different dynamics. Number three, don't make sudden changes. No one knows the exact price of individual 2027 plans right now, and if they say they do, guess what? They don't. Official plan-specific details will not be released by CMS until September, and full reviews take place during open enrollment. So what should you do? Don't panic. Don't fall for fear-based messaging telling you to jump ship. Simply wait for your annual Notice of Change letter, commonly referred to as your ANOC letter, which arrives in your mailbox either each year in late September or early October. Review your premium. Check your medication list. Compare plans on Medicare.gov and adjust if necessary during the annual election period that runs from October 15th to December 7th. I hope this video was informative, and we look forward to seeing you next time.